If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Welcome to Ask the Doctor. It's great to be with you today. This is the finale of our 13th season. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, by calling the phone line. This is live at 718-499-6101. And second, and I've been getting a lot of these during the week, email us your questions to askthedoctor@netny.net, and we'll bring them into our discussion. For tonight's episode, we have Dr. Claudia Lapidus, radiology attending at the New York Methodist Hospital. Dr. Daniel Stevens, laparoscopic and general surgeon at the Metropolitan Hospital, and Dr. Bruce Garner, chief of rheumatology at the Lutheran Medical Center. Welcome. And I'm glad you've stayed on. I know the mass ran late, currents ran late, but I know the switchboard was lighting up. Where's Ask the Doctor? But we're here, and we're going to do a full show tonight. So you may have to stay up a little late, but you'll have the eyes may be blurry tomorrow morning, but we're going to be here. What's going on in the news? Well, there's one interesting topic about gastric bypass surgery, and this is those the type of procedures that you see where the guy's 800 pounds and they do a procedure where they affect the stomach, the capacity of the stomach, and they lose a lot of weight. But there are different types of procedures that can be done. Not all are equal, and it turns out that one is better than the other, and we're going to talk about that with Dr. Stevens, who's one of the experts in the city in this topic. And when we come back from the break, we're going to be discussing what is the bypass and what are the other methods and what does he think you should be doing if you need it. Now, also in the news was a topic, high triglycerides, and this is a type of fat, not cholesterol, but it's another type of fat that we really didn't pay too much attention in the past to. Turns out that the higher the level of triglycerides may be a better predictor of who's going to have a stroke than even cholesterol. So it's something that each of you out there should know your number, and it should be below 150. And this is non-fasting. You go in, you get your blood taken. If it's not less than 150, you need to talk to your doctor about how you're going to get it down and what kind of strategy is going to, that you're going to use. So this is very important topic. Now, another topic is how to live longer. People constantly coming out, how do you live longer? What do you do? Well, high fiber may be the answer, okay? And taking more than 29 grams of fiber a day for men and 26 grams for women, and you can check it on what you're eating, whether it's going to be, fruit, vegetables, whole grains, or even if you Metamucil, some people will take grains in that form. You need to take about 29 grams a day. And if you do that, you have a decreased incidence of cancer and even heart disease. Turns out that the fibers have an anti-inflammatory effect and actually can help inflammation that goes on in the blood vessels, which leads to strokes and leads to heart attacks. So it's very important. You want to talk to your doctor about your triglyceride level. Everybody should know that. It should be below 150. And you want to talk about the fibers in your diet. I want to talk about Monsignor Bennett, who I know takes fibers. We eat out a lot. We go to the River Cafe once a month, and Monsignor knows his fibers, so he's a happy man. And of course, you run into people during the week who are Ask the Doctor fans, and I had the pleasure on, it was Sunday night, we were out in Piccolo Venezia. Everybody, I think you know that place, in Astoria, excellent place. And who do I run into but Monsignor Harrington, the Vicar of Communications, and they were celebrating with Father Sauer, who was recently appointed priest of St. Mel's Parish, St. Mel's Church out in Flushing. And he was with Father Jim King from the Assumption of the Blessed Mary, Virgin Mary at Brooklyn Heights. So it was a great meal. I was waiting to see who was going to pick up the bill at the table. Monsignor Harrington's hand paralyzed, but no, he did get out there. And it was good seeing everybody out there. And congratulations to Father Sauer. Now, we have a tricky quiz because we had a quiz last week and we have a quiz this week. Now, last week we had a special submit your answer via the email quiz. This was tailored celebrating the upcoming Oscars. Who's ever, I don't know who's celebrating that here, but whatever. I'm not writing it. The question was the 83rd Annual Academy Awards will take place on February 27th. That's some background. Who received the longest ovation of all time at the Academy Awards? So who got the longest ovation? We received quite a few responses, and here they are in top 5, no particular order. Number 1 was Philip Robinson from Queens. He said it was Elizabeth Taylor. Then we had John Murtha from Middle Village who guessed Charlie Chaplin. Then Johnny D'Amato from Whitestone guessed Jack Palance. Remember, he's the guy that did the push-ups with the one arm and the thing is Maniac. And next, James Leonard, who answered Charlie Chaplin. So a couple for Chaplin. And then Angelo Rizzo from Brooklyn Heights thought also Charlie Chaplin. So you out there, we're going to give the answer right now. So if you want to just play along in your minds, the answer is, okay, now if we had a sound effect and a drum roll, you would have, I'm trying to play into that. The answer is Charlie Chaplin. He received the longest standing ovation back in 1972. And the winner is, again, trying to build this up. The winner is James Leonard. James was the earliest submission, followed closely by others. It was a tight race. James submitted his answer at 8:16. Amazing. And we have, this is all done on the left, 8:16 p.m. that James got it in. So I want to thank everybody. We're going to do it again next season because it's such a big hit. And now today's quiz. Before the hairdryer was invented in 1920, what common household appliance was promoted for its hair drying ability? Okay, so in 1920, the hairdryer was invented. But before that, what were people using to dry their hair? You know, they take a shower, they want to go outside, you want your hair dry. What do you use? What common household thing? So I'm going to let you think about that. We're going to take a short break, and when we come back, we're going to go to our questions. Now, remember the topics are radiology, laparoscopic surgery, general surgery, and rheumatology. The number to call is 718-499-6101. And remember, you can email your questions to askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are radiology, laparoscopic and general surgery, and rheumatology. Now, before we meet the doctors, we're going to have a special, again, in keeping with the upcoming Oscar performance and the 30-second spots that you're seeing regarding reviews of movies. We want to get an idea what our audience thinks was the best picture of the year. So when you call in, we're going to ask you that. We're going to tally them up and see the unofficial poll, what the Ask the Doctor group feels that it should be. So let's meet first Dr. Claudia Lapidus. Hi, how are you doing, Claudia? Nice to see you here today.
Thank you very much. It's very nice to be back here, part of such a wonderful team. And as a radiologist, we look at images and help clinicians and surgeons, medical doctors to make diagnoses. So hopefully if you have any questions regarding to your CAT scans, your ultrasounds, your MRIs, anything that we can help with, I would be happy
You're always
to answer.
colorful. You always wear a beautiful color. And you just went skiing, right?
Well, more I was enjoying the nature. I wasn't really skiing that much, but certainly enjoyed. I was in Hunter Mountain.
Very
beautiful,
nice.
Beautiful scenery. Beautiful.
So you're all set to tackle these problems, right?
Well, hopefully.
You're relaxed. Okay, good. Dr. Danny Stevens, it's a pleasure to have you here.
Thanks for
having me. I have to get to you, this question.
Yeah.
Gastric surgery for obesity. What's available and what do you recommend?
I'll be very quick because it's actually a very complicated question and there's no straight answer. But first of all, I would take these studies with a grain of salt because they're a small number of patients in each study and they're short-term follow-up. Second of all, there's no one right operation for everyone. There's a different number of bariatric or weight loss operations, including the gastric bypass, the sleeve gastrectomy, and the lap band. Each operation has advantages, disadvantages, pros and cons, certain complications. So I would like to see bigger studies with longer-term follow-up. So you really need to think about it, do your own research if you're interested in the surgery, and talk to your doctor. There's no one right operation for every person.
And one other interesting thing, I noticed it came down. It used to have to be like 100 pounds overweight or various formulas. Now it's like 60 pounds. They're bringing it down into sort of moderately obese.
They're trying to get bariatric surgery accepted for less obese patients with diabetes and high blood pressure, so hopefully it could expand the realm of the surgery.
So I know you do them. You want to go to a place where they're doing a lot of them,
High
right?
volume, yeah.
So that's the key. Anybody has questions, we're always available to help out with referrals. Anything, do you take any exciting trips lately?
Just Disney World.
Oh, that's
It was fun. I took my boy.
Did you go on a Small World?
We went in a small
Does
world.
that get in your head and you can't stop singing It's a Small World after all?
I'm still singing it.
So it's great. How old is he now?
8.5 months.
Wow, it seems like he was just 3 months when you were here 5 months ago. I don't know. It's amazing. It's great to have you back. Thanks a lot.
Congratulations on 13 seasons.
The end of, they said, when this came on, they said, nah, this is never going to last. You see that? You never know. They said that.
Wonderful.
Yeah. Excellent. And Dr. Bruce Garner.
They said that when I got married. We celebrated 18 wonderful years.
I think you've been telling us you've been driving around with your kids trying to get them into
my
the right
oldest
program.
son's applying for college, and my youngest son is a sophomore over at Brooklyn Tech. My oldest son's at Stuyvesant. And my oldest son's made a few schools, some very fine schools, and we're seeing now who's going to give us the most financial aid, hopefully. But, I did want to say one thing to Danny and get his opinion. There was a study which appeared last week on obesity and osteoarthritis. And what they determined was that people who are obese and have osteoarthritis have fewer quality of life years, meaning they may live a reasonable span period, but those years are hell. So if I have someone who has osteoarthritis who is 60 pounds overweight, should this be something I should be considering for him or her?
Absolutely. I mean, obviously they need to lose weight in some fashion. They diet and exercise first. If that fails and they're a candidate for bariatric surgery, it really helps with all the aches and pains and arthritis of the knees and the back.
So you hear we have a great topic. I always save the best for last. So season finale always has my favorite doctors on it. So I'm looking forward to the show. And let's see, who is our first caller? Could it be Joel? Hello? Hello? Is anybody there? I think did we lose our first caller? Okay, so at this point, I think we go to the email question. Okay, so Linda from Brooklyn wants to know, good evening, doctors. I have hypothyroidism and I take 1 tablet, 25 of levothyroxine daily. How can I heal this naturally by diet? So she wants to know, how can she treat her thyroid by diet?
The answer is you can't. And thank God there are medications to treat it. I think that certainly we always want to do, quote, natural things. And there are a number of supplements and herbal medications that certainly can help as adjunct therapy to medicinal therapy. However, in your case with the thyroid disease, there isn't any proven, quote, natural cure for this, but you can control it very nicely by taking what looks like a relatively low dose of thyroid extract. So I think in this case, you do have to take the medication and you have to be monitored by your primary care physician.
Thank you. We have another question now, and I'm getting update from our engineering team that the speaker blew, apparently. So this is what, we have to introduce the term preventive maintenance around here, but we'll work on that as we go on. Number 2, Ingrid at Marine Park. She wants to know, she has high blood pressure, and she's had a sonogram that shows no blockage. My doctor wants me to have an MRA of the kidneys done. Is this procedure necessary? And I'll call on our radiology representative, Dr. Lapidus.
Very good question. Now, the reason for high blood pressure, there are multiple reasons, but one of the reasons may be the artery, the renal artery may be small, and so the way the blood is getting to the kidney is such that the kidney starts secreting some chemical which actually increases your blood pressure. So the kidney can't increase your blood pressure by secreting certain chemicals. So what the doctor wants to do is really take a look at not so much the kidneys, but the MRA is to look at the artery that leads to the kidneys. So MRA is really an angiogram using MR. So nothing needs to be done. It's not an invasive procedure. Sometimes we use some contrast, which is pretty safe. And so it gives you a chance to look at the whole renal artery and to see whether that could be the cause, if there is stenosis, of the hypertension that you have. So that is a good study to have.
Thank you. And what we're going to do is we're going to take a short break. And when we come back, we're going to be taking your questions. Now, remember the topics: radiology, general surgery, laparoscopic surgery, rheumatology. So we'll be back in just a couple of minutes. Don't go far. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Well, welcome back to Ask the Doctor, where our topics are radiology, laparoscopic surgery, and rheumatology. Dear Dr. Garner and panel of doctors, hi, my name is Michelle. I'm 35 years old and I'm emailing you from Gravesend in Brooklyn. My question is this. In 2010, a neurologist ordered a series of MRIs on my spine. She did the cervical and thoracic, and hopefully I'll get the lumbar part MRI too at some point. But when I got the results back, it said cervical lordosis, and then for the thoracic, 2 herniated discs. I was told that the cervical lordosis was nothing, and that the 2 herniated discs, everyone has herniated discs. Is it true that everyone has herniated disc? I ask this because my spine often hurts or goes numb. I have a great deal of mobility and spasticity, coordination problem, to the point where they ordered me a power chair because I'm unable to walk. So let me recap this. There's a person who was 35 years old, went for an MRI and was told that she had 2 herniated discs and she had some curvature of the cervical spine. She wants to know now, she seems to be confined to one of these wheelchairs that are going around. Does that make any sense? Does everybody have cervical disc or thoracic disc? Should she be worried about this? We're going to go around the room for this. So we'll start off with Dr. Lapidus and then move on.
Okay. First of all, lordosis is just referring to the curvature of the spine. And that in itself may be related to muscle spasms or can have other reasons. So lordosis referring to the shape of the cervical spine. The MR is a very sensitive test, and it's true that we pick up a lot of different diseases, a lot of disc problems. And it's very important to correlate the findings on the MR with the symptoms that the patient is having. So to say that everybody has a disc problem, that's not true. But with age and degenerative changes, we do find a lot of disc changes. You're young, so that is a little bit different. We can't say it's normal. However, the most important thing is to look at where the discs are, what levels, and whether the symptoms that you're having correlate with these discs. So that would be, a neurologist would be able to see whether or not this becomes significant. So the findings will become significant if the symptoms correspond to the level where the discs exist. So that's what I would tell you from the MR point.
Okay, Daniel.
I agree completely. Herniated discs are not normal. Everyone does not have herniated discs. If they're causing you a problem, then something should be done about them. And there are different treatments. I'll let Dr. Garner discuss some of the medical treatments, but there are medicines, there are injections, and then there's surgery. So those are your realm of treatments, medical and surgical if medical treatment fails.
The interesting thing to me is we have so much wonderful technology that I think we tend to overuse it. And I recall when I was a fellow, not that long ago, MRIs were just becoming prevalent, and they actually did a study, and they looked at people in a doctor's waiting room, a general practitioner's waiting room, and it turned out that close to 90% of people over the age of 45, in fact, did have what are known as herniated or slipped discs. So as Dr. Lapidus said, the important thing is to correlate those slipped discs and see if, in fact, they're clinically relevant, clinically significant. Because we have the technology, we're seeing more and more of this in people, but clinically, quite often, it is, as your doctor said, perhaps it was a poor choice of words, nothing. But in reality, it doesn't have clinical significance in many patients.
So thank you. And you know, we were talking about the Academy Awards coming up. I thought we'd get a little discussion around the table, see if any of the panelists here had a favorite film of the year. So, Dr. Lapidus, what was your favorite film of the year?
King's Speech.
A King's Speech.
Definitely. I like the development of the character. I really felt for him, and I kind of lived through his problems. So I was really in the movie. I was all there, and I enjoyed that.
It was well done. It wasn't
really
boring.
Well done. No, I enjoyed it very much.
The King's, we're keeping track out there. King's Speech has 1 vote. Danny?
I have to go with True Grit because I love the Coen brothers. Their dialogue is spot on all the time. I'm a big fan.
Excellent. Then Dr. Garner?
I vote for the King's Speech. I would agree.
Too.
My wife Elise and my 2 sons Benji and Kenny and I saw it in the movie together, and the whole family. I just think that years from now, this movie will be viewed as a classic, and it'll be shown. If we had $1 Million Movie, those of you who are old enough to remember, it will be shown over and over again on $1 Million Movie.
I enjoyed. I like The Social Network. It was a good show. I enjoyed it kept you interested. It was based on a true story, right? Fairly true.
Absolutely.
So, okay, let's go to another email, and this is from Odessa in Queens. Odessa wants to know, is that a big name in Russia, Odessa?
Yes, it's a port on the Black Sea.
But you're named after? It's like being named Brooklyn, or what? What is that?
I think it's, well...
Whose name?
Odessa...
It's okay?
That's okay.
Well, so Odessa wants to know, she's a type 2 diabetic. She has arthritis in both legs, knees, and feet. She's 55 years old, and she has something torn in her knees that tires her legs out if she's on them for more than an hour. She needs to lose weight, she admits. She wants to recommend a low-impact exercise program for me. And we'll start this way at the other end with Dr. Garner and come back.
Well, there are a number of things you can do, Odessa. One of them is, in fact, walking that half hour. And the studies have shown that if you walk a half an hour 3 times a week, that you might build up the muscles around the knees, which helps take some of the pressure off of those things that are torn in the knees. Also, the walking helps the circulation in the legs. So you might find that the more you walk, because you have a better circulation, especially being a type 2 diabetic, you're at risk for poor circulation, which could affect this feeling of tiredness in the knees. If you walk, you might find that tiredness doesn't come as rapidly as it did previously. The other thing you might consider is if you have the ability to join a gym, either a stationary bike, or you could just have a stationary bike at home if you're fortunate enough to be able to afford one, or a regular bike, you could go out bike riding, or the elliptical machine. Doesn't put too much stress on the legs either, but will help you build up your muscles.
Dr. Stevens?
I absolutely agree. I think the low-impact exercises of choice usually are the stationary bike, the elliptical machine, and that'll take a lot of stress off the knees. So you definitely need to lose the weight, Odessa, and that'll help with the circulation, diabetes.
What do you do for your exercise?
Well, I walk a lot, actually, especially in the summer. I love to walk on the boardwalk. For me, walking, enjoying, just looking around, seeing the ocean is the best way. Not so much for the gym. I'm a little bored there, but outside, outdoors is for me.
Yeah. How do you get people to continue to go? You know, they can start off the first week, 2 weeks, but at the end of 10 weeks, they're not doing it.
You have to make it fun and interesting. Play a game, play a sport, a little competition. And you have to get your heart rate up also. You can't just, walking's good, but you have to walk to get your heart rate up above 120 or 140. That's really how you lose the weight.
So I have good news and bad news. First of all, the bad news is that it's not fixed yet, okay? But the good news is we have the email, right? So not that our audience is the big email. We're not techies out there. This is not the social network that's watching the show, but try and figure this. If you can figure out the computer, you can get your questions to us at askthedoctor@netny.net. Okay, so netny.net, you're going to get to the page, and where it says Ask the Doctor, click on it, and you're going to get your answer. So I think we might have even had another email question, although maybe, we've got an answer? There's a quiz answer through the mail. believe it or not, what was used to dry one's hair before 1920? Who did that?
That's his answer.
That's his answer. He's saying it's the vacuum cleaner. The vacuum cleaner to dry your hair before 1920.
Can imagine.
And it looks like it's regards Stephen Garfinkel from Brooklyn, New York. Let's see, is that right? Wow, we have a very smart audience, very smart audience. I can see Stephen Garfinkel's full information. So he's from Brooklyn, New York, and he's a grand prize winner, and he's going to get the very valuable plaque is coming out to him, and there's another way to get it. Now, there's another quiz that I was afraid if somebody got it too quickly, we have a second quiz. And the person who wrote the theme song to Car 54, Where Are You?, which was a famous song, I don't know if you guys remember it, but in the 1960s it was a big show. It was about these inept two policemen, and it was a comedy. And it was a theme song that he wrote. In the theme song, it talked about the show, there was a leader of a foreign country mentioned. If you can tell me who the leader of that foreign country was, you're going to get it. Now, I know that Dr.
I could sing you the song.
We're going to save that to the end of the show to give some people, just if they want to tune in. So again, the show was Car 54, Where Are You? Who was the foreign leader that was mentioned in the theme song? Okay, so you can have another one. Now, let's take another shot at this. Let's just see. Hello?
Hello?
Wow.
Yeah.
First caller.
Who is
First
this?
Caller.
This is Sheila from Brooklyn.
Sheila, you're the first caller of the night. Did you know that the phones were going to come back, or you just took a chance and hoped?
I took a chance.
This is great. You see that if you have a dream, you can sometimes, it comes true. So were you surprised about the answer to the quiz?
Yes.
Yeah, me too. The hairdryer. What would you?
Sure.
Interesting. So what can we do for you?
All right, I have a problem here. The problem is I keep getting polymyalgia rheumatica. I seem to be prone to it. Why? Why is that?
Yeah, it's interesting. It's a very frustrating topic, often underdiagnosed topic. I know that rheumatology.
Polymyalgia rheumatica is a disease of inflammation of the muscles, so that a patient who has polymyalgia will have painful proximal, meaning the part of the arms and the part of the legs, close to the hips and close to the shoulders. Do you have that, Sheila?
Yeah, I have stiffness all over and a lot of pain.
Okay. Now, how did they make the diagnosis of polymyalgia? Do you know?
Well, the doctor took a blood test.
Okay.
It was very high.
I'm assuming you mean your sedimentation rate?
Exactly.
Okay, that's a sign of inflammation. There are two common signs of inflammation we look for in blood tests. One is called the sedimentation rate, and one is called the C-reactive protein. We don't often see polymyalgia in people younger than 50 years old. You don't have to tell us your age, Sheila.
I don't mind.
Okay, how old are you?
I just turned 70.
Wow, you sound very young.
It's a young voice.
Yeah, well, I look young, too.
I'm married, but thank you. My wife is very jealous. But you certainly sound like someone, all kidding aside, who looks young and sounds young. And to tell you the truth, we don't know why you keep getting these recurrent episodes of polymyalgia. One possibility is that the treatment for polymyalgia rheumatica is prednisone. It's a steroid.
Yes.
And doctors try and take patients off of steroids as soon as possible because of potential side effects. But it turns out that some people need to be on the steroid for at least 1 year or longer, and some people need to be on a very low dose to control this for years to come. So you may be one of those unlucky people.
Actually, I was on the prednisone for a couple of weeks, and then that was 5 milligrams, and then the doctor lowered it to half of 5, and for 2 weeks, and now every other day.
That's an insufficient dose, Sheila.
Yeah?
We usually start at 20. If it is polymyalgia, we usually start at 20 or 10 milligrams a day. Minimum of 10 milligrams a day, and we don't go down that quickly, so that's probably why you're not responding as well as we'd like. So you might suggest to your doctor that you see a specialist, a rheumatologist.
Where are you located?
I'm in Bay Ridge, in Brooklyn.
If you call up, we can get you the address, the phone number, and everything, okay? We're ready to cross. You see it across the screen now?
Yeah, I see your phone number. I took it down.
Very good.
I have a question for you. One before I leave. I'm going in for knee surgery in third week in March. Do you think I should go through with it?
I'll let the surgeon handle that one.
Yeah.
Well, that's a tough question also. What are they operating for?
Well, my knees are both shot. It's bone on bone at this time.
All right.
And matter of fact, I have to walk with a walker because I can't walk.
Yeah, you know, Sheila, it's a tough question, but if you're really debilitated and it sounds like they may have tried other things, surgery is usually a last option, but if you're really debilitated and you can't walk, it might be the right thing for you.
That's what I'm thinking.
Very good. Dr. Lapidus, you want to add something about the x-rays of bone on bone?
Well, yeah, the x-rays will show how the spaces in the knee and how the bones next to the joint look. And when you're saying bone on bone, it's usually very little space left, and there's a lot of sclerosis and changing in the bone themselves. So the sooner you take care of the issue, the better it will be.
Thanks. And what's your vote for Picture of the Year? Sheila?
What's that?
What's your, again, before we let you go, what's your favorite movie of the year?
Oh, so far it's been The Kids Are All Right, too.
Oh, interesting.
I love that picture.
Yeah, well,
Annette Bening.
Yeah.
That's good.
I don't know. It's interesting, but I always kind of thought it was overrated.
I
But,
did too. I didn't care.
but anyway,
for
no,
it.
you're entitled. Everyone's entitled to his opinion. So have a good night.
Thank you.
Thanks.
Pleasure talking to you.
Good to talk to you. Now, we lost Joe Stiles, who's been on the line. Joe, I know you're out there. Try again. And also Grace, who's a very loyal listener, has been on the line for quite some time. We're now going to go to Gloria. Hi, Gloria.
Hi.
Gloria, how are you doing?
I'm in pain.
Oh, I'm sorry. I can hear you. Sound very subdued tonight.
Yeah,
Where are you calling us from?
Brooklyn,
Which part?
Crown Heights.
Crown Heights, yeah. Not much in the way of restaurants out there, right?
Yeah.
No. But before we get into your topic, what's your vote for Picture of the Year? Which was your favorite?
Oh, I love all the movies.
You like all of them?
Yes.
But you got to pick one. What one stood
I
out?
love looking at,
The internet?
no, 48 Hours.
48 Hours. That was, when was that?
Eddie Murphy
A
and
while
Nick
back.
Nolte, a while back. Very classic,
I think-
seminal buddy movie.
Gloria's going to these like 25-cent movie theaters where they show the films from 8 years ago. Gloria, you gotta get, that was 8 years old, that movie. But it's,
I know.
no, it's all right, it's okay. But what can we do for you?
I have problems in my leg, and I've been had it ever since November. They told me to stay off it, and that's it.
That's good. So it sounds a little better than, when you got on, I was really upset. You just have a little trouble walking?
I have trouble walking, yes. I walk with a cane.
Okay, did they do x-rays?
They didn't find nothing wrong with it.
No. All right, we'll go around the table.
Well, you've had the problem since November. Were you injured in any manner, any kind of accidents?
Nope.
Have you gained a good deal of weight recently, and are you putting more weight on the leg?
My weight goes up and down.
Is it in a period where it's going up at this point, where you might
Nope.
be... Okay.
I'm losing weight.
Well, it's very difficult to answer your question, honestly, over the phone. This is the kind of question where your primary care physician needs to do a good evaluation.
Well, they
because-
told me I have an appointment for rheumatology.
Okay. Well, hopefully the rheumatologist is going to be able to help you figure out what's going on, what the cause of it is. There are many different causes of leg pain, and they can range from circulation to muscle to joint pain. So it sounds like you're on your way to it.
Well, they had told me I have bursitis.
Well, bursitis is inflammation around the joint, and thank God it's very easy to treat.
Gloria,
Uh-huh.
so you get out there and you get out there when you can. Do walking, it's good, the more exercise. Anybody else have any thoughts?
I agree. You need to see a good internist and get a full workup. Maybe bursitis, maybe something else, but only a doctor who examines you can really tell you what's causing the problem.
And Dr. Lapidus, one x-ray, let's say she could take only one x-ray, what would you pick?
I would pick the hip.
The hip, interesting, okay. So, Gloria,
Uh-huh.
I hope that helps, and you call us back, okay?
But do you think MRI would show up something?
The MRI?
Yes.
Yeah, should she get an MRI?
I think I'd like to know a little bit. I said the hip because it sounded to me like you were saying like you couldn't move your legs. So I wasn't sure, because the knee, you would have said the knee. when you said the leg, I thought maybe coming from the hip. But MRI is very good to look at the hip, to look if there's any problems with joint, fluid, whether there is inflammation. That's definitely going to be seen on MRI. And if there's no answers there, you can always do the MRI of the spine, from which also you can have pain generating down your leg. So there's a lot of imaging. Start seeing the doctor and then take it from there.
Bye, Gloria. Have a good night.
Same to you.
Take care. Okay, I think we got Joe back. Joe?
I'm here.
Joe is still on the board of trustees at several hospitals and organizations.
That's nice.
They're doing a
Hello.
film about his life. Joe? Joe?
Yeah.
I was just telling the audience about the film they're doing about your life.
Oh, yes.
Who's doing
And,
that?
you know, I'm on the board 32 years.
Wow. But Joe, they're doing a movie
All right,
about his
let's talk.
life. Hey, Joe is in his 90s.
Wow.
Joe,
Yeah.
how old are you now?
I never getting old. Time is passing by. I'm getting better.
Excellent.
I'm
Good answer.
93. I reversed to 39.
93.
Hey, you tell me, leave the TV on and shut the phone off?
No, you did the opposite. Then we're going to lose you if you do that, Joe.
Okay,
Keep
all
the
right. Now
phone
listen. My problem is, doctor, and let's face that thing, I held you in high esteem. I know you a long time. I have a thyroid, enlarged thyroid.
Okay.
And it's been this way the first guy I went a couple of years ago wanted to cut. I don't feel it there. I know it's there. So in the meantime, I went for a CAT scan. I also went for a sonogram, and I went to a famous guy, you must know him, Dr. Minkowitz, that did a computerized biopsy. I have no cancer. I'm benign, okay? And now they put me on a pill recently. Oh, what did I do? Oh, yeah, they put me on a pill. They claim it might help me out. I met a doctor that's not a gastroenterology, an endocrinologist.
Okay.
Yeah, and he gave me a medicine I'm taking now, Synthroid.
Synthroid.
I took 25 CGs, and then I took 50 now, 14 of them, and I took 1488 CGs in a couple of days. They want to take my blood work again and check me out.
Joe, let me hold you at this point. Let me just turn to Dr. Stevens. Joe, he had a thyroid mass.
Yeah.
Was found to be benign, and he's put on Synthroid now, which is a replacement. Yeah.
Joe, this is good news. I mean, the worst thing it could be is cancer. So if they took a biopsy and it's not cancer, you should be very happy. It sounds like your thyroid isn't functioning so well, so that's why it enlarges sometimes. So you need to be on the Synthroid, which replaces the thyroid hormone. So I would keep taking that, and they got to test your blood regularly to make sure you're on the right dose. But, just stay on the dose that your doctor tells you and keep on going. You live another 93 years.
Oh, that's great. I was told the same thing by a doctor in New York at Sloan Kettering.
Excellent.
And he said to me, but I'm hoping that this medicine will shrink it, and I'm going to go get the blood work done again on it, and I'm going back every 6 months. I go get a biopsy done of it, and this guy's supposed to be the best. You know him, Dr. Garner?
I don't know. I see the other Dr. Garner knows him.
I know him by name. We've sent some patients to him. Excellent reputation.
He does neck and head. That's all he does.
Excellent. So you went to the right place. You got treated right.
That's right.
We agree. So, Joe, have a great week.
Likewise. And listen, doctor, I'm very sorry for your loss.
Thank you very much,
God
Joe.
bless you.
Take care.
Take care.
Amazing person, Joe Stiles. Okay, let's go to Pat now, one of our long-time loyal listeners. Pat?
How you doing, Dr. Garner?
Pat, look, we had this trouble tonight with the phones. Were you affected by it?
No, not at all, no.
Good. Good. I was trying to build up a case, Pat, that people couldn't get through and stuff. I appreciate that.
No, I got right through. Matter of fact, I called 3 minutes ago.
Okay, don't rub it in. It's okay. It's okay. Pat.
How you been?
We've been all right, thank you. Thanks. So what's going on with you?
Not too much,
Pat's a
Dr.
long-time listener. He's had a lot of problems, and you could tell.
Yeah,
any listener to the show knows he's had some problems, and he's worked it out now, and he's back on his feet.
Yeah. The only thing I have, Dr. Garner, I had the colonoscopy taken, and I had the stomach scoped, and they said everything was good. But I still have this problem with in other words, remember I told you used to get the lightheadedness?
Yes, yes.
It seems like I get this reflux. It comes into my chest, and I get very lightheaded. I don't know what it could be, and it happens all the time.
Right. So, Dr. Garner?
I really can't comment on it. I think that it sounds like you're doing the right thing. I would continue to let him or her work you up. If the lightheadedness becomes too much of a problem, it might be something a neurologist is more qualified to look at.
Dr. Lapidus, how did you look to verify that there was reflux there? What would we do?
Well, we can do an esophagram or upper GI study. What that is we have you drink a little bit of barium, and we actually ask you to either like increase the pressure, like so Valsalva maneuver, like pressure, put like some pressure, and then we see how high the barium goes in your esophagus. If somebody has reflux, it will not stay in his stomach, but go up back into the esophagus. And we'll look how high it goes. Is it in the lower esophagus, mid, and upper esophagus? So we can look at that with an upper GI esophagram study very easily and physiologically see how high your reflux goes. So that's
Right.
Dr. Stevens?
I think it's a good idea also. You know, to diagnose reflux, also you can get what's called a 24-hour pH monitoring study. The gastroenterologist would do that. Have you been on medicine for this? Pepsid, Protonics?
I take Nexium in the morning and I take Pepsid at night.
Does it help at all?
You know, when I'm taking the Pepsid at night, it helped a lot.
All right, so then it probably is reflux then. So, you know, you should keep taking the medicines. If it doesn't get better, you may need, again, you may be one of those rare people who actually need surgery for this.
Really?
There's a surgery that treats bad reflux, which is really causing you severe symptoms. You should talk to your gastroenterologist about surgery and maybe a referral to a surgeon.
And Pat,
Right. One other question. He had taken the endoscopy in my stomach, and he says everything was fine. That wouldn't show up.
Not necessarily. You could have reflux and have a normal endoscopy.
Pat,
yes.
Before we let you go, what's your favorite movie of the year?
I'm watching it right now, The Godfather, on my other TV. Dr. Gardner, one other thing, Dr. Gardner. My nephew, you remember he had got hurt?
The quadriplegic, yes.
Yeah, he got married on Saturday.
Wow.
that's great.
Congratulations.
Fantastic.
I want to say hello to my friend Vinny from 18th Street. Very loyal listener. Thanks, Doc.
Be well. Vinny, thanks a lot. Give us a
Take
call.
care, buddy.
Take care,
Okay,
Pat.
man.
We're now going to do the rapid fire because, believe it or not, there's 10 minutes left in the show. I don't know where this time went to. So we're going to go around the room. We're going to start off with Rosie on line 4. Rosie. Rosie. Rosie? Rosie.
Hello?
Hi, Rosie.
Hi,
Rosie. Turn down your TV.
Huh?
Turn down the TV, and we can't quite hear you.
Okay, I can hear you now.
Okay, what's the problem, Rosie?
I just thought because I have like a burning in my chest.
Okay, did anybody...
Burning in your chest?
Yeah, I don't know. So I something like blockage or something.
Well, that's certainly something you do need to see your primary care physician for. One of the things we mentioned earlier, just with the last caller, is you can get burning in the chest from reflux. So you have to visit your primary care physician and find out what the cause of it is.
So that's we're going to move. This is the rapid fire segment. So, and what's your favorite movie?
Officer and a Gentleman.
Which one?
Officer and a Gentleman.
Officer and a Gentleman. So, I mean, in this audience, for this year's Academy Awards, these are the favorites. 48 Hours, Godfather, and Officer of a Gentleman. And that's why I don't understand why we don't get better advertising. But thank you. Thank you for that show. Okay, now we're going to go to Grace. Hi, Grace.
Yes, hi.
Grace, what happened to today? I don't know.
I was number 1.
I know you were number 1. I can't
Yeah,
count.
they disconnected me.
I know, but the whole lines went down. You didn't see that we had a big problem. There was a blue.
Yeah.
But we're going to try and answer your question quickly.
I'm sorry for your loss, Doctor.
Thank you. Thanks a lot.
Yeah. Well, my favorite movie is True Grit.
True Grit. So Dr. Stevens and you agree. I think that might put it in the lead.
Yeah.
Well,
2-2.
No.
2-2.
And you know, you owe me a plaque. I was number 1 and I knew vacuum cleaner because the canister vacuum cleaner, one end sucks in and one end blows out, and that's how you would blow your hair.
Yeah, but you don't want to blow it on suction, because then you.
No, I said the other direction.
That was and you knew that answer?
Yes.
All right, we're gonna. I have to figure. I'm gonna place it to the judges. Okay.
Okay, good. Canister vacuum cleaner.
Okay. It's definitely going to the judges. All right. Grace?
Yeah.
Okay. You got a question?
Yeah, for my husband.
Okay.
He got 3 opinions for his retina.
Oh, the retina.
Because he can hardly read, and he got distorted vision, and he had a cataract on that eye taken out 5 years ago, and he was fine. But now all of a sudden, since August, he can hardly read and has distorted vision. So he went to 3 opinions of retina specialists, and they finally decided that he has a swollen retina and fluid and they're giving him injections called Avastan.
Okay.
Can anybody help us on that?
We'll tell you a little bit about the Avastan.
It's blood vessel growth
right, it stops the growth,
right?
the neovascular, the blood vessel.
You know, I'm not an ophthalmologist. None of us here are, but
I know.
But you know what? Avastan is an important drug. You've gone to 3 specialists, which is the right way to do it. When we have the ophthalmologist on here, we don't have right now, but we're going to have next season. We're going to address this issue. Okay? So we won't forget you. And
Okay, because I would like to help my husband on that.
we're definitely going to help. Grace, have a great off season, and we're going to see you in a month.
Yeah, don't forget my plaque.
No, the plaque is the canister. Right?
Thank you.
Okay, bye. See, this plaque is very in demand. People joke about it, but people want this plaque. They come in. We got, hello?
Hello?
Is this Maddie?
Yes.
Maddie, I was getting nervous. We haven't heard from...
Please, I couldn't get, you don't know how it is to get through to you people. Well, I'm glad I got through at the end.
But Maddie, so how have you been?
I want to know, is it good taking the medication for dizziness?
Yeah, Maddie's been having dizziness. She can't go outside as much as she'd like to, and it's been hampering her lifestyle.
Yeah. But anyway, I'm glad I got through to you.
So Maddie, we're going to answer this question.
Yeah.
Maddie's been taking the meclizine, or is it helping at all?
Yeah.
It is helping.
Yeah.
All right. Anybody have experience with that?
Yeah, I have personal experience. I was in the hospital, unfortunately, a couple of years back for vertigo, and they treated mine. It was called benign positional vertigo. I took the meclizine, which is simply an antihistamine. It's like Dramamine that you might take, or Benadryl. And it's very safe, and it works very well for dizziness. So as long as it's helping you, Maddie, continue taking it and be
Maddie,
well.
It's so good to hear your voice. Great to
Okay.
We missed you, and we'll see. We're gonna take a 1 month break.
I started from the beginning.
Wow.
But then I didn't even see that you were going to be on.
I know it's very tricky tonight, but thanks a lot. Our listeners can't be. Thanks, Maddie.
I'm glad I got through. Okay.
Thanks. See, our listeners cannot be fooled, no matter how much. Vida, we got Vida, which is an interesting name. Vida.
Yes, hi, how are you?
Oh, what's the name?
It's Vida.
Vida. I say Vida, you say, but
because they call me Vida, Vida. As long as it's either one of them, it's okay.
You know, there used to be a famous baseball player named Vida Blue.
Oh, yes.
But Vida, what can we do for you?
It's a long story, but in short, I was diagnosed with Sjogren's syndrome.
Okay.
And I've been to a few rheumatologists, and I'm really not happy with any of them. You know, like I'm still having the same pain and everything. I did find one, but I live in Brooklyn. He moved to Mount Sinai, and I was listening to Dr. Gardner, and he did at one point prescribe prednisone, and it helped me a lot. And right now, with the pain, I was just diagnosed with a meniscal tear. So already on Monday, I'm going to have a procedure, surgery for that. But I was just wondering if any of that was connected. And I also had an MRI. I work at Brookdale Hospital in the radiology department.
Okay.
And I had an MRI, and the radiologist, he determined that it wasn't a tear, but I also went to an orthopedic doctor there, and he said sometimes it doesn't show on the MRI. He just, checked me, and he determined that I do have a meniscal tear. So I had 2 questions for the radiologist. Is that possible that you could read the MRI as basically negative without seeing a meniscal tear, and then I could go to orthopedic, and they could say it is a meniscal tear?
Okay, and what's the second question? We're going to do both quickly. Which is the second one?
Well, the Sjogren's syndrome is just, I'm just having an issue with that. I'm on medicine, and I'm still in a lot of pain.
Okay, very good. So we're going to do question number 1. Can it disappear, a meniscal tear, not see it on MRI?
Well, I think that clinically it's very important that you went to the doctor who examined you and thinks that you have a meniscal tear. It's very important. So that's number 1. Now, meniscal tear sometimes can be very subtle. And if there's not too much fluid, you actually can miss it if you because you're only cutting every few millimeters. You're not getting a continuous view of the meniscus. So it's possible that if it's a subtle tear, that it was not seen. Or there may also be some scarring together with other process that's going on. So I would stay with the diagnosis of a tear as the clinician examined you. And they can repeat the MRI, or they can do some look in and see what's going on with the meniscus.
Well, I'm already going to do that on Monday, and I do have what they call a Baker's cyst, which I just found out in the back of the knee.
1 second, because I want to get Sjogren's syndrome in 30 seconds.
Okay, I'm ready.
Okay. Sjogren's syndrome is a very common syndrome. It occurs in 1 out of every 200 women. Usually it's just dry eyes and dry mouth. It's less common in men. It can cause pain. And if it does cause pain, usually prednisone is not the first choice. We usually try a drug called hydroxychloroquine, and we try other medications such as other anti-inflammatories. But it's something that is very difficult in 30 seconds to discuss, but certainly Sjogren's syndrome can cause pain. It's not connected to the meniscal tear.
Can I ask one more question?
No, I would love it, but we can't.
Does Dr. Gardner take $11.99?
I do.
Okay, you got that in?
I'm sorry.
Thanks a lot, Vita. Okay, and Dr. Stevens, one last question for you. I hear amazing things that you're doing with this laparoscopic surgery, taking out organs, kidneys, and things. Just tell, it's amazing. I mean, this basically does away with this long recovery period from surgery?
It can. I mean, there's still a recovery period, but usually it's a lot better than if you have to do an open surgery. But that doesn't preclude surgeons from doing open surgeries. I did one today, a big open gallbladder. You still have to know how to do it. So you can't do every operation laparoscopically.
The bottom line, go to the right person, go to the person with experience, and you're going to do okay. You're going to have the best chance of doing okay. Nothing is 100%. I mean, I'm sorry we had such a rocky last episode of the season, but I couldn't think of a better group of doctors to have this rocky period with. I want to thank Dr. Claudia Lapidus, Dr. Daniel Stevens, and Dr. Bruce Garner for coming in. And we hope we've been able to help you. Remember, it's good that you should always be proactive about your own health. Speak to your doctors about your concerns. Go for second or even third opinions. We've seen that tonight. In the meantime, visit our website at netny.net/askthedoctor. And here you can see video blogs, my tablet column, podcasts, the forum. You can send in your quiz suggestions, and many more. And you can also watch last week's episode tonight at 10 p.m. I want to thank Dr. Linda Lapatosa, the quizmaster, and I want to thank you for all your questions. Now, big announcement. We'll be back for our 14th season on Tuesday, April 5th. So you want to mark your calendars. We're going to take a short break, give everybody a chance to recharge, and we're going to be back Tuesday, April the 5th for our 14th season. And hopefully you'll be able to catch us on reruns. You know, just keep looking over the net and you're going to find us. So I want to say goodbye. Thank you for all your calls, and I'll see you in the tablet.